Dr. Richard Merkin, CEO of High Desert Medical Group, strongly supports the recommendations of the Center for Disease Control that pregnant women get vaccinated for the H1N1 swine flu. CNN spent the day at High Desert Medical Group reporting on this story.
An update today on how the swine flu vaccine is affecting some of the most vulnerable patients. Federal health officials say they're finding that a single dose is working well for almost all pregnant women. But they say young children will still need 2 doses for the best results. CNN's Cara Finstrom looks into the threats expectant mothers potentially say they see for themselves.
A year of twists and turns for Nancy Brizendine.
I was like, what?
This past spring, an unexpected pregnancy for the 42-year-old. Shock turned to celebration, and then just weeks ago, that jubilation turned to fear.
I had like a cough, like sinus infection, infected ear, nausea, fever, and then that's when I went into the urgent care.
Nancy tested positive for the H1N1 virus, and the fact that she was pregnant put her right in the middle of a group that experts are most worried about.
Women who are pregnant seem to be somewhat immunocompromised, and it just turns out that women who get the H1N1 tend to get sicker than the general population.
I couldn't even get out of bed and lift my head because I was just so sick and achy.
It's tough enough to fight the ravages of H1N1 at home, but many pregnant women end up waging a much more serious battle. The Centers for Disease Control says pregnant women are 4 times more likely than other H1N1 patients to end up hospitalized. Just last week, an expectant woman from El Monte died from the H1N1 virus. She was 27. Doctors say for some reason, the virus seems to cause the most serious complications in women who are both pregnant and young. Nancy believes age worked in her favor. She got better with Tamiflu and rest. But Nancy wasn't just worried about one baby on the way. You see, Nancy's 22-year-old daughter, Kayla, is also pregnant. And doctors strongly suspect she also caught H1N1.
One more time.
The difference? Kayla, who had no health problems, ended up with bilateral pneumonia and on oxygen support.
Like I was hyperventilating because I couldn't breathe.
Was she at risk of dying? I mean, how?
Yes, absolutely, absolutely.
Honestly, I thought, okay, is God giving me this baby because he's going to take my other baby? And I didn't want that to happen. So it was hard. It was real hard. And that's, I'm thinking, okay, what can I do being here? I need to go to the hospital. I need to be with my baby, but I couldn't.
3 weeks later, doctors say mother, daughter, and both of their unborn girls seem to be doing very well.
I got the girl one. Yeah.
But still, there are fears.
I was just worried. I mean, like what effects is this going to have on my baby? And what effects are the medication going to have, or what's the effects the x-ray is going to have?
Since the virus doesn't cross the placenta, probably not too much of a threat, at least that we know of. However, if there are very high fevers in the mother, that could affect the baby.
Health officials are urging pregnant women to get the H1N1 vaccination, and Kayla and Nancy agree.
And you have to realize it's not just you, it's your baby. Yeah. You have to protect both of you.
In Lancaster, California, Cara Finstrom for CNN.
High Desert Medical Group in Lancaster, California was featured on numerous CNN programs throughout the day on November 2nd and into the evening hours. Dr. Anthony Dolgaroff, Assistant Medical Director at High Desert Medical Group, was prominently featured in the story as he recognized early on the deadly nature of this disease and its impact on pregnant women. High Desert Medical Group represents the cutting edge of healthcare and medicine with emphasis on patient-doctor relationships in numerous ways that present solutions to the nation's healthcare crisis. High Desert Medical Group covers 40,000 patients in the Lancaster-Palmdale area, 7,000 of which are seniors.
Fold your shirt up for me.
High Desert Medical Group and California lead the country in adopting health technology systems. 52% use electronic medical record systems versus 15% in the rest of the country.
The savings are passed with electronic medical records are passed down to the patients primarily in improving their care.
High Desert has established a distinct clinical research program aligning with major pharmaceutical companies testing new drugs to fight major diseases.
These might include diabetic medications, blood pressure medications, cholesterol medications, new vaccines. We can allow our seniors to have exposure to these cutting-edge medications.
In an ongoing effort to support wellness and community outreach, High Desert Medical partners with local hospitals, medical experts, and business leaders to actively support numerous organizations and an annual Senior Health Expo.
Well, good morning and welcome to Senior Expo.
They recently celebrated their 19th annual Senior Health Expo.
For the land of the free and the home of the brave. God bless America. Amen.
Over 4,000 people attended, getting free flu shots,
Didn't even feel it.
bone density screenings, blood pressure checks, and meeting with their healthcare specialists.
I'm so proud of everyone in High Desert Medical Group to try to indicate to the seniors that health is so important, that with preventive care, they would live longer and higher quality lives.
That's your blood sugar, huh?
That's your blood sugar. It is a little elevated, okay?
The theme for this year's Senior Expo was Life in the Fabulous 50s, featuring June Lockhart, star of Lassie, Tony Dow from Leave It to Beaver, and Eleanor Donahue from Father Knows Best. They came out to chat with the seniors, remarking on their long television careers and on being seniors themselves.
I'm happy to be here, and I'm going to walk around and see what's available here. I understand there's certain tests, like the BMI and blood pressure, and also some other medical exhibits, and I'm very excited about it.
It's great. It's a lot of fun. A lot of people are here, and the flu shots are being given.
The benefits will help me today to understand more about health care.
Every year, a prominent senior from the Lancaster community is named Senior of the Year for their volunteer efforts.
And it is with great pleasure that I announce the 2009 Senior of the Year, Charlie Towner.
Mr. Towner is a longtime volunteer, picking up and delivering Christmas trees to needy families.
It feels real good to be Senior of the Year.
We're gonna rock around the clock tonight, put this glad rags on.
And what would celebrating the fabulous 50s be without a senior talent show?
You know when that shark bites with his teeth, dear, scarlet billows start to spread. Oh well.
You make the cotton easy to pick. Maine, you give my old mint tulip a kick. Maine, you make the old magnolia tree blossom at the mention of your name.
Where the boys are, where the boys are, where the boys are, someone waits for me.
In other words, please be true. In other words, I said in other words, I love you. That's it. I love you. You're a nice audience. Thank you.